Hi there. Welcome to another episode of our diabetes series, right? I am your dietitian Fechi, and today we'll be looking at the complications of diabetes. Now, you need to know that diabetes comes with complications when you don't take care of it, right? When you don't control your sugar, and at a certain point your sugar rises to a level where it will start causing a lot of problem. Okay, now that is why you need to take it seriously. Take your treatment seriously, all of your treatment. We dealt with treatment the last time. If you want to see the link to that video, go to the description. You will find the link to where we discussed about treatment and all of the series we have done so far. You need to know this condition, right? Now, in this video, I will help you to understand the complications of diabetes that you may not know about. One of the first complications that happens to people living with diabetes is diabetic ketoacidosis. Now, diabetic ketoacidosis is the first or one of the first, complications that you experience. What happens here? You remember that I said in my previous video, I've always maintained that the cells are starved during diabetes. Okay, the cells are starved of sugar, and that is why your sugar remains in the blood and increases your blood sugar. The liver is activated to start acting on behalf, to improvise. And this happens, to stress the liver because it will have to break down the fat and then convert them from, the fat they are to a sugar that the body will need to use. All right. So normally the system is not, to function in that manner. The body was not meant to function in that manner. But because of a breakdown or a disorder, the liver is activated and the liver is made to convert fat, you know, to sugar for the body to make use of them. All right. Now, when this happens, it leads to ketones being produced. The outcome of that is that ketones are produced, and a lot of ketones you find in the blood. That is why you have diabetic ketoacidosis. That is, there is a lot of ketones spread in the blood. Okay. Now, this is a complication and is not healthy because over time it will lead to some other things and it is not healthy for you. All right. So the body needs to eat, the level it needs for it to function maximally. This ketoacidosis happens majorly in type 1 diabetes where there are no insulin, produced. Okay. But for some type 2, it can also happen. That is where you see people suddenly they lose weight, you know, and it also happens when you don't take care of yourself, when you don't start taking care of yourself early enough. So that is why I usually tell people whenever you notice the symptoms of diabetes video is right there in the description. So you can go check it out to know when you're diabetic. So a lot of, changes happen and there are things that you yourself you start noticing it, and when you notice it, it's not a time for you to take your own medication. No, I don't prescribe medications here too. So it is a time for you to go see your doctor so that you'll be properly diagnosed. There are major signs that the doctor look at, and when the doctor looks at those signs and sees that you have them, now the doctor will diagnose you and tell you what to do and give you medications. And then you have to see a dietitian also that will also guide you. There's a program we are running, 30-day program for people who are diabetic, and we keep you people in a taught, you're given diabetic education, and you're supported with everything that you need, for you to be healthy. Okay. Now, this is what we would like to help you do. If you're interested, click on the link to my WhatsApp. I will connect with you and I will tell you exactly what you need to do to be part of this program. Okay. Now, this is it. Okay. So, diabetic ketoacidosis is one of the first things that. Now, there's another thing that happens: non ketotic hyperosmolar coma. Now, this happens for people who are ignorant of their diabetes, for people who don't know or who are not taking care of it. It can happen. It's a major complication that most people don't even know. Now, it is a form of coma that happens due to when your blood rises, your blood sugar rises to extreme high level. Now, what happens is that the fluid in the cells are drawn out of the cells. Osmosis happen, you know, the movement of fluid from the lower concentration to the higher concentration. Normally, sugar is meant to be in the cells and also around the blood. Yes, right. Now, but when it remains in the blood alone, now what happens is that osmosis happen and fluid is drawn out of the cells, and when fluid is drawn out of the cells, you discover that the cells become dehydrated. Okay. And sugar in the blood is moved to the kidney where it is passed out as urine. That is why you see people who now urinate, and when they urinate you see ants gather around it because there is sugar in that urine. Okay. In the brief history I gave about diabetes, the description, you will see the link where we'll give it a brief description. What they use in diagnosing people in the old age is that the sea ant will come to lick the urine of people who have that disease. At that time, they don't know what it was, but over a period of time, they discovered diabetes, right? Now, our great grandparents, they suffered diabetes. So don't be deceived to think that diabetes is something that just came up. No, they suffered it, but they gave it a name and it happened. Non ketotic hyperosmolar coma, it happens for people who are neither not aware of their diabetes, and when their sugar rises up to over 300, they are susceptible to any form of coma. They can collapse, they can fall, anywhere. You can see somebody, they just tell you that this person collapsed in somewhere. It just happens the same way stroke can happen, right? So you experience that coma for a particular period until you're stabilized, right? So it's not something you would want. And that is why you need to start taking care of their diabetes right now. Keep the numbers low, keep them normal, and I tell you, you will enjoy hypoglycemia. Hypoglycemia is one of the complications that might happen in a diabetic patient. What happens is that your sugar drops lower than normal, and at this point, there are three major things that can lead to this. Okay. It's either that your insulin, you took little dose, okay, or you did not take your insulin at all. Okay. This is where you can have, when you're prescribed insulin, you either took a little dose of it or you did not take at all, right? You forgot to take it or you just decided not to take it because some people say they don't want to be taking it. Now, you need to know that you can have this complication. You are susceptible to it. So if you don't take your insulin, the dose that you're meant to take, there's every chance that you may have hypoglycemia, especially if you're suffering from type 1 diabetes. Okay. Type 2 diabetes, you may, find a way around it through other things, but you know that you will have issues. The second thing that may lead to hypoglycemia might be that you took little amount of food. Okay, you may be starving yourself thinking that you're doing the right thing, and some people go on fasting. I've seen people who tell me that I don't eat, I eat only once. I've seen people who tell me that I don't eat, I eat only once a day, just to keep my sugar low. But that's not it. That's not what is meant to happen. You can run into hypoglycemia without knowing, and hypoglycemia is even more dangerous. Yes, it's even more dangerous. The same way hypotension is more dangerous. Hypoglycemia is even more dangerous. So don't starve yourself or eat little amount, small, very small amount of food just to bring down your sugar. You just need a moderate food that is enough for you. And that is why you need a dietitian to help you map out that strategy. Okay. Next thing that happens is that you may do more exercise, more than the time you should do it. Okay. This can also lead to hypoglycemia. Oftentimes, I usually tell people who are diabetic, who I have in our program, that whenever you're going for exercise, have a bottle of drink, you know, to take care of any hypoglycemia crisis when it happens, because it can happen, right? You may not really know when it will happen. So, whenever you're going for your workout or what have you, just take a drink alongside with you, so that when you have any crisis, you can take half bottle of that and take it, right? Now, this is how you need to do it, all right? This is how you take care of, this hypoglycemia. The next thing that happens is erectile dysfunction. This is for men, okay? Erectile dysfunction is one of the complications of diabetes. And this also happens when you're not able to control your sugar. And over a long period of time, what happens is that you are no longer able to enjoy sex with your wife, with your spouse. You're not able to enjoy sex. And then you lose interest in everything about sex. Now, what happened? Because the nerves that send signals, for certain hormones to be released and for certain cells to be active, those cells are no longer functional. So those signals are no longer sent. Now, because of the high sugar in the blood, there are some hormones are no longer produced as they ought to be produced. Now, it is that your testosterone level will drop. Okay, the nerve that control the holding of ejaculation is no longer active. So whenever you're making love to your spouse, you discover that you ejaculate easily. The muscles that hold you from ejaculating easily is no longer active. So the bladder, it can either drop in the bladder or it pours out from your penis. Okay, it pours out from your penis or it drops at the bladder. When it drops at the bladder, it is called retrograde ejaculation. Retrograde ejaculation. It simply means that the muscle that controls your sperm from moving out of your penis is no longer strong enough. So it opens up and drops at the bladder, right? And before you know it, somebody that used to last longer in sex will now become a 1 minute, a 2 minute person. Okay, now this is a problem that happens, but what you need to do is to start treatment. Start eating the right thing you need to do, start taking the right medication, start doing your exercise. those lifestyle changes, once you initiate them, you over a period of time, we have had it. We have a group specifically for men that have this issue where we handle them. Okay, we tell them exactly what they do, and the result has been amazing. Amazing result. Okay, amazing result. And that is exactly what they pay for, and we help them over the time. They start giving us, their result. They are active again, and they are now able to satisfy and enjoy sex with their wives. Okay, now, this is the part one of these complications. I'll give you part two in the next episode. The next episode, I'd like you to subscribe to this channel so that you know when we release these videos. And if you've not been following this series, you can go back. Go to the description of this video. You will see the link to all the videos we've done on this series, the diabetes series. You'll see the link to every one of these videos, and I can assure you, you will get loads of value. Like this video, subscribe, and then comment. Let us know what you think about this series and share your idea. What is it you would like us to improve on? Thank you so much for listening. I am your dietitian, Fechi, and I'll see you next time. Bye for now.